Hello friends, I am Dr. Rahul Agarwal, Consultant Vascular Endovascular Surgeon, Care Hospitals. Today we are going to talk about non-healing wounds or unhealed wounds. Now, when do we call any wound as unhealed wounds? Whenever the wound is not healing for more than 2 weeks of duration, we can call it as unhealed or non-healing wounds. There are multiple factors which could be either locally associated near or around the wound or systemic factors related with the patients which can lead to non-healing wounds. Let's come to the local factors which are very easy to identify first. So local factors could be lot of necrotic or dead tissue around it or in the wound. Otherwise, there is infection in the wound, or the wound is not getting proper dressing, or the movement in or around the wound, like the wound is on a joint, then it keeps moving, that hampers healing. So these are the common local factors which hampers the healing and delays the wound healing. Now coming to the systemic factors. In systemic factors, which are the patient related factors, like a patient may be hypertensive, he may be diabetic, or he may be having a vascular disease like a peripheral artery disease, which leads to decreased blood supply to the wound. Now, most common cause in a diabetic patients with a non-healing ulcer is an underdiagnosed vascular disease or the peripheral artery disease, which if not corrected, the wound may never heal, and the infection and the wound will progress and can lead to limb amputation or loss of limb. Now, who are at risk of developing a peripheral artery disease, that is a vascular disease, are any patients above the age of 50 years, patients who are hypertensive, diabetic, or had a previous episodes of a cardiac issues or stroke. So these are the patients with a vascular disease in any other system or any other artery in the body. So they can also have a peripheral artery disease which leads to delayed healing. So screen them, consult a vascular surgeon, get your peripheral artery disease screened and get it treated for a better wound healing. Thank you.